Okay. Okay, let's get started with the video. I'm going to tell you full disclosure. I'm doing a reaction video to a lot of these reports that I have been seeing about rural healthcare shutdowns, and and I've already watched them. I've critiqued them. I've thought about them. I've thought about my responses because I want to do it justice. So I didn't want to just do it on the fly because I wanted to, address things that I thought were important. I'm going to point out that in none of these videos and all of these hundreds of different reports that have been happening since 2010, really, because the pandemic did not start the closure of hospitals. Hospitals started declining in the 1970s. They hit a real stride in the 90s, and they've been declining ever since, but they're picking up. And it has nothing to do with the pandemic, even though, many people are using that as one of the main points. And we'll go and get into that later on, especially if I do more of these videos, I'm going to break that down piece by piece, how the pandemic is not the issue here. One thing I noticed in all of these reports that is consistent, you will never hear anyone from the revenue cycle department of any of these organizations talking or being interviewed. They literally will not talk to them, or the hospital will not put them up front. And who better to talk about the hospital finances, low reimbursements, payer complications, error to billing than the revenue cycle management team? But you will never see one. And if you do, they're talking to the CFO or something like the financial officer, but they're not talking to the medical billing manager or the director of revenue cycle. And I find that to be very interesting. And I point that out because I want you to understand where I'm going to go with this. If you're a revenue cycle management professional, you already know where I'm going with this. So let's start the video.
We are back now here at 7:30 and starting this half hour with an important story about community health care, a story that many of you out there are going to be able to relate to. It's a CBS News investigation that finds healthcare institutions that Americans rely on are being taken apart and then shut down by investors who are looking for profits.
Okay, so I'm going to stop it right there. Healthcare systems that Americans rely on are being taken apart and sold off for profits by private investor groups. How did they get those hospitals? How did they come in contact? How did they get control of that hospital? We're just going to skip all of that. We're just going to get right to private investors, and they're selling off hospitals and closing them down. So now we're 75% into the story. We don't know the first 75%. This is where the reporting starts.
Our investigation focuses on one company in particular that made millions of dollars and then closed some of its community hospitals, leaving patients scrambling for care. It's part of a larger trend of investors from the world of private equity snapping up everything from local doctors' practices to specialty clinics and even hospice care centers. Our chief medical correspondent, Dr. John LaPook, is here with the story. John, this is a big one. Good morning.
Yeah, good morning, Tony. For nearly a century, Delaware County Memorial Hospital in suburban Philadelphia delivered babies, treated trauma, and tended to the critically ill. That all changed earlier this year when its current owner, a Los Angeles-based company called Prospect Medical Holdings, began cutting services. First, the maternity ward went, then the operating rooms and the ICU, and then last month, the emergency room closed its doors to the community's nearly 85,000 residents.
Okay, so it's very important too that they make sure you understand it's a private equity firm, and they're from Los Angeles. That's very important. It's California, right? It's a very intentional wording. It's meant to put your hair up on your back and put you on your back feet and get you really defensive about these greedy Californians, right? These West Coast carpetbaggers. I don't know what they would call them, whatever they're calling them. That's really intentional, and I want you guys to acknowledge that because it might feel good, right? It might feel like satisfying, but it serves to cover up what needs to be addressed so that the problem never gets fixed. So just keep that in mind.
This is what it looks like when a hospital shuts its emergency room doors, turning away patients like Shirley Posey.
I was having shortness of breath and tightness in my chest.
Latifah Dixon and her two children showed up after getting into a car accident. They too were turned away, along with 28-year-old Cecilia Vizuete, who is having trouble feeding her 1-year-old daughter because of a breast infection. They said I should look on Google Maps for another hospital. Inside
Okay. So now we're getting an insight into how the hospital was running prior to the special interest groups getting a hold of it. You should look on Google to find another hospital. If you're closing down to a community of 80,000+ people, you have not made any provisions for handouts or flyers or options or addresses to other hospitals. You're waiting for people to come to the hospital to tell them, look on Google. That really speaks more to the internal workings of the hospital than anything else. And you would just normally just slip over that, but that is crazy. When I worked in behavioral health and substance abuse, right? If somebody called and they wanted to get on Suboxone, or they wanted to get on some type of drug and they wanted to see the doctor, and we didn't have any openings, you didn't talk to a patient on the phone, and they're telling you how they're trying not to relapse, and you're like, sorry, we're full, we're not taking any patients. Call back in May. That was not the option. That is not how I trained my front desk staff. That's not how I trained my clinicians, front end, back end. I said, we are full. We're not taking any patients for until this day or that day. We might have had our waiting list. Sometimes we did, sometimes we didn't. But here is a list of other options near us or near you where you can call. And then you can call this number for general help. So there was always an answer, even if we had to turn them away. So just the thought of people coming to an emergency room and somebody behind the door saying, just go ahead and Google where you can go. You live in that city. You've been there probably your whole life. You don't even know where to go off the top of your head. That really, that really bothers me, and that really, that speaks more to just the type of training and service you were going to get anyway prior to them closing. I'm going to rewind.
Emergency room
I want you to notice something.
doors.
Okay, where are the signs? If you don't want to tell people this all the time, you're closing, you're closing your doors, you're an emergency room. Where are your flyers or signs or notes, directions for these people, these poor people? It just doesn't sit right with me. So let's continue.
Inside Delaware County Memorial, the hallways and patient rooms, normally bustling, were empty, except for a few nurses charged with cleaning the place out.
I cried. I'll be honest, I cried.
Emergency room nurse Angela Napolitano is the president of the local union and worked there for 41 years.
My children were born there, saved my dad's life in the emergency room, so it's a part of me.
Delaware County Memorial was part of a non-profit Pennsylvania health system that was in danger of failing when it was purchased in 2016 by Prospect Medical Holdings. A Los Angeles-based for-profit company. With the backing of private equity investors, Prospect Medical's portfolio would, by 2018, grow to 20 hospitals in 6 states. After the Pennsylvania purchase, the company had promised to invest $200 million to dramatically increase service to the community.
They tried to tell us that they were going to run us the same way. Don't worry, trust us.
Did they actually say that to you?
Yeah.
Instead, Napolitano says Prospect Medical dismantled the hospital piece by piece.
Now, I don't necessarily disagree. They may have run it the same way because you were in trouble in the first place financially, right? That's why they have access to you. They got a hold of you because something was wrong with the money in the first place. So the fact that it closed down after they took it, maybe they did run it the same way. They might be telling the truth there, right? I'm sure there's more to the story, but I doubt, well, I already know because I've watched it, they're not going to say anything about what they changed because they didn't change anything.
Don't worry, trust us.
Did they actually say that to you?
Yeah.
Instead, Napolitano says Prospect Medical dismantled the hospital piece by piece, leading to longer waits in the ER and forcing staff to transfer more patients to other hospitals.
They kept on cutting services. Things wouldn't get fixed. Our elevator in the back of the emergency room has been broken for over a year. Holes in walls, not fixed. And then when they closed the ICU, that was a knife in my heart.
Okay, so you might go, What are you talking about? They didn't do anything differently. She just said they're cutting services and they're closing the ICU. Right, they're closing the ICU and they're cutting services, but that still doesn't mean they are not running it exactly the same way. Remember, before they took the hospital was failing. The hospital was going to go under. So running it the same way, that would have been the natural progression. Services would have closed down, the ICU would have closed, all of those things would have started to fall apart. So what I am saying here is that I'm pretty sure they ran it the same way. And then they just kind of prolonged it maybe a year or two, maybe a few years. But what was going to happen if they had not taken over a private interest group was going to happen with them because they ran it the same way, if that makes sense.
CBS News investigation found of the 20 hospitals owned by Prospect Medical, 5 have closed, including this 89-year-old hospital in San Antonio, laying off more than 500 workers.
We wouldn't see a hospital closing down if this was a more affluent area.
Delaware County official
I agree with that, but not for the reasons that what she's saying. Hospitals, rural hospitals, urban hospitals, low income hospitals are notoriously known for understaffing, under training. They refuse to send their workers to, especially their RCM staff, to retraining. They will not upgrade the systems. They won't give them what they need. They won't help them out with outsourcing, right? They won't help them out with AR. So I agree that you would not see this in an affluent area where high quality of service is required. And in order to provide that high quality of service, you need to make sure the staff is trained. You need to make sure that the money is flowing so that the environment and the equipment is up to date and new, and you can hire the best of the best. So those communities demand more, and therefore they get more. That's not necessarily. I'm steering away from nothing is controllable here. This is very controllable, including the people who are running these hospitals in the more urban, lower income, rural areas. If you're not demanding more, right, and you're not having you don't require higher standard of care, higher standard of customer service, then all of that is going to reflect. And it's not necessarily just a random entity that is targeting you as an urban, rural, low income hospital. It is your own internal mentality, your own internal standards, what you want for yourselves. That plays a big role too, and no one wants to really address that.
San Antonio, laying off more than 500 workers.
We wouldn't see a hospital closing down if this was a more affluent area.
Delaware County official Monica Taylor says closing what's considered a safety net hospital will hit the area's low-income population hardest. What happens to a community when it loses its only emergency room?
There aren't resources nearby, and so we find that people wait longer to go to the hospital. It leaves a gaping hole in this community that is going to be very hard and very difficult to fill.
In a PowerPoint provided to the county, Prospect Medical cited high labor costs, record inflation, and the COVID-19 pandemic. But according to Taylor...
Okay, and so I want to point out high labor cost, record inflation, and the pandemic means nothing. What does that mean? Where are the numbers to show the specifics on what they're talking about in terms of inflation? What has gone up? What pricing has gone up? What material has gone up? In terms of high cost of employment, have you been on a freeze? I'm pretty sure you were on a freeze for probably years. So where does that come in, right? And if you were to tell us that, well, reimbursements were very low, then that would explain how the cost of employment might be too high. But because they want to keep that secret and they never want to talk to the reimbursement team, they're not going to address that, or they're not even going to put it in there. They're going to slip it in just in a passing reimbursements, but they don't want to list it as an official cause. High inflation, the pandemic, and cost of labor. What about collections, reimbursement? Why isn't that listed as your official reason? One of them. Well, because it would trigger questions and an investigation, and that's what they don't want.
The company has been reluctant to share its financials with the county. You think they've been leveling with you?
No, I had a sense that they were not giving us all the information.
They didn't care about healthcare, doctor. What they cared about was making money for their investors.
Rhode Island Attorney General Peter Nerona says what's happening in Pennsylvania is what Prospect Medical tried to do in his state, where he says the company drove 2 hospitals deep into debt.
Their hospitals were in real danger of closing.
In 2019, Nerona investigated a proposed company transaction, invoking state law to force Prospect Medical to turn over its financials, and found it put every hospital in its system at risk of reduction in services, sale, or closure.
Did they say, look, there was a pandemic, who could have predicted that? And that's really largely responsible.
Well, this had nothing to do with the pandemic.
Thank you, Mr. Nerona. So I don't have any issue with what Mr. Nerona is doing. It's a separate issue. If he wants to bring the hammer down on special interest groups, fine. That's all good. The problem started before he even got involved, and it has something to do, it's totally related to something totally different. So I'm not defending the private investors, right? I'm just saying that this whole reporting made to seem like this is the problem. The private investors is so disingenuous. It's not correct. It's so incorrect. It throws you on the wrong path. There's a fork in the road. One is to the right answer, one's to the wrong answer. Reports like this take you to the wrong answer, to the wrong solutions, to the wrong processes, to the wrong everything, because you're not even addressing the root cause of the issue. And none of the causes of what might have caused that to happen to you, we're going to act like it doesn't exist. This is what is happening here. And unfortunately, huge consulting companies, I mean, multinational global consulting companies are following this path. And this is why the hospitals are constantly closing. They're not getting a foothold on any of them. And it's because they don't even know what they're trying to do, because they're all looking at it with the story halfway done, 75% done. Let's continue.
Hospitals all over the country were facing the pandemic, but the problems here were exacerbated, frankly, by greed.
2 different outside experts followed the money and discovered one reason why the company was so far in the red. Some
follow the money. If you're an accountant, you understand what follow the money means. And if you're following the money, you're following it from the beginning of the story. You're not following it from this point. So that's a problem. You're not following the money.
The problems here were exacerbated, frankly, by greed.
2 different outside experts followed the money and discovered one reason why the company was so far in the red, summed up in a ruling by Nerona. In 2018, the owners of Prospect Medical took out a $1.12 billion loan, using proceeds to pay themselves and their private equity shareholders a $457 million dividend.
They basically took a big loan out, okay, $1 billion loan out, and took nearly half of that loan, and rather than invest those loan proceeds in the hospitals that they owned, put the money in their pockets as dividends.
How did they try to pay back that loan?
They sold the hospitals off and leased them back. So now you're even in a worse position.
In Delaware County, that lease...
Okay, so stay with my line of thought here, because I know it's getting hard for people to it may be getting hard for people to understand. All that they are talking about is irrelevant. It's irrelevant because they have not addressed why the private equity firms have the hospital in the first place, right? So now they're just piling it on, doing nefarious things that private interest groups do. We already know that's what they do. No one's defending them. No one is shocked. If Nerona wants to go after them, great, he can do that. If he doesn't, that's a problem for another time. But what I'm saying is, this report is going on and on and on about all the things the private group did, and it is going further away from the solution, the origin, and the problem. And I have no idea if this is strategic, if this is, what is happening here, that every single report is going the same route, starting from 75% of the story already completed, and then being like, oh my God, I need a transplant, my liver, my kidneys, but they don't tell you how you got there. It's wild to me. It's so wild.
Back arrangement meant $35 million a year in rent had to come out of hospital budgets. This
as dividends.
How do they try to pay back that loan?
They sold the hospitals off and leased them back. So now you're even in a worse position.
in Delaware County, that leaseback arrangement meant $35 million a year in rent had to come out of hospital budgets. This after Prospect Medical's owners and private equity investors paid themselves that $457 million dividend.
You know how much that was?
No, I don't.
It was $457 million.
Oh my God. That makes me want to cry. It makes me sick because that should have went back into the hospitals and into the community. And the whole time that all this was happening, they were blaming the staff and COVID.
With the
So how come the hospital couldn't get the $1.2 billion loan or $6 billion? How come they couldn't get it to reinvest? You see what I'm saying? So they could have done it, but they didn't. So what they did was they sold off a hospital that was still making a lot of money to a private group that took that revenue, and that revenue was still enough money for them to get a $1 billion loan. So that means the hospital could have also received that loan and went out for the loan. Why didn't they do it? Right? Maybe they did, maybe they didn't, but it's still, I have a hard time believing that any financial institution would not give a working hospital another loan. They might have already received loans, but the revenue is so high, right? It was high enough, obviously, for this special interest group to get a loan with the revenue that was coming in. So how come the hospital didn't get their own loan or several loans, okay, before they had to sell it off to the private investor group? We'll never know, because we started the story way past that. They already owned it by the time the story starts.
COVID.
With the hospital now shut down, a judge next week will hear arguments over whether to require Prospect Medical to find a way to reopen its doors.
What they've done is extremely evil, in my own words.
Why do you think it's evil?
Okay, but they're going to open up. And since then, I think I'm pretty sure they have reopened. So you sold it to a private investor group, they gutted it and opened it up anyway. So there's so many things wrong with this industry and system, but it's all covered under don't look over here. Don't look, don't ask these questions. A private investment group from California, Los Angeles to be exact, came over here and ripped it apart. They're doing the most evil things to us. Don't look over here. Don't ask these questions. Pay attention to this. This is what you need to be paying attention to.
Because to gain $1, you've maybe destroyed lives, maybe even ended lives, because they can't get the help that they need.
In a statement to CBS News, Prospect Medical said it's cooperating with health officials and working to transition Delaware County Memorial to a behavioral health facility. In an annual report, the company said it has lived up to its commitment to invest $200 million in the Pennsylvania health system. Prospect Medical CEO declined an interview, but the Rhode Island Attorney General told CBS News that the Prospect Medical CEO's share of the $457 million dividend was about $90 million facility. In an annual report, the company said it has lived up to its commitment to invest $200 million in the Pennsylvania health system.
So earlier, it talks about $200 million into the hospital. Now they're making a statement saying that they have lived up to their commitment to invest $200 million into the Pennsylvania health system as a whole, or the hospital. But you know what? We're not going to follow up on that statement, because why would we do that? That would just clarify things. Let's continue.
Prospect Medical CEO declined an interview, but the Rhode Island Attorney General told CBS News that the Prospect Medical CEO's share of the $457 million dividend was about $90 million.
Wow, that's pretty jaw-dropping what you just showed us. It reminds me of something that Commissioner Bratton told me years ago, that something could be awful, but it's lawful. So is this legal, what they're doing?
Yeah, I asked Peter Nerona, who's the Attorney General for Rhode
Yeah, it can be awful, but it's lawful. And it's very lawful. I think that we should probably look at If Prospect Medical's CEO got a big check, what did the CEO of the hospital get when they sold the company? Normally, when you get laid off from a job or your job closes down, you get some kind of, you know, severance pay. So what did they get? That executive team that sold off a hospital to a private investor group that later went and got a 1.3 or 6, I got to go back and look, $1 billion loan based off of the revenue that the hospital was currently providing, the land it was currently sitting on, and all the options that they could have leased it away to. So that means they had the same options to get these loans, but they didn't. They sold it to a private investor group because maybe they were able to get a little more out of that little parting selling it than if they had just turned it around. Those are the kinds of investigations that need to be had, but we're not going to do that. That's too logical.
Rhode Island is illegal. He said, at least in his state, it is. But the big point here is, the Attorney General for Rhode Island is illegal. He said, at least in his state, it is. But the big point here is, the only reason why we were able to follow the money is because Attorney General Nerona invoked an unusual state law that forced the company to turn over its financials. Wow. And his advice to everybody else out there is, look, there's a lot of these deals going on, and he really encouraged other states to create legislation that allows more transparency so they can look behind the curtain when these kind of deals arise.
So you don't...
Okay, so what kind of deals? There's going to be a bunch of new laws for private investor groups. Wonderful. But what about laws for the hospitals? Right now, the prior hospital was a not-for-profit. They made sure to really emphasize that right before they said that Prospect Medical was a for-profit, Los Angeles-based special interest group. Like, they really wanted to do that. So I did look on, and this is like a spare of the moment video. I did look for some of the public information regarding the hospital. I found a bunch of stuff, but I need to look into it, right? And do some analysis and do what I do, right? But I'm going to come back for another video to really talk about what was going on with the hospital's finances prior to them selling it to this private investor group. But it's incredibly frustrating when you're dealing with rural hospitals and you're dealing with, well, let's finish it up and then I'll start talking.
I don't think this is an anomaly, what you just showed us?
You know, it's hard to know, right? Because it was a record year last year for private equity investing in healthcare. Yeah. And, you know, we just don't know because we don't have the money trail and all the others. But, you know, it leaves me with the thought, what happens when private equity brushes up against health equity?
Look at the people that are being hurt. Yeah. That's the thing.
That was eye-opening and heartbreaking. Dr. John LaPook, thank you very much.
We are back now.
Eye-opening and heartbreaking, guys. That was eye-opening and heartbreaking. Two of the things that irk me the most. It's not eye-opening. It's a distraction. It's a smoke screen. It's a fork in the road, and you're choosing and you're being led down the incorrect road. And it's heartbreaking because the heartbreaking part is necessary in order to cover up the obvious answer of what is happening with these hospitals. Now, I've seen reports about everything, every cause under the sun about why these rural hospitals are closing. Shrinking population, low birth rates, low income communities. They have government assisted Medicare or Medicaid. They don't have insurance at all. So nothing is coming in. All of these reasons are not the sole reason why rural hospitals are closing. So the hospitals are not doing a lot of things, right? They're not really investing into their RCM teams. They're not updating the information. They're not sending their teams to special education, continuing education. They're not updating their software to combat the billion-dollar software that the payers are utilizing against you for algorithms and instant denials and all the things that we've been seeing in the news lately, all these lawsuits. And here's the thing, the payers don't care about getting sued. If you think you're hurting a payer and because you got $2 billion from them or $600 million for them, these payers are sitting on billions and billions of dollars of profit, and they do not care about a $600 million fine here, $100 million fine here, $1 billion fine there. They don't care. So there really is no incentive for them to stop doing that. And so when hospitals in clinics and hospital systems are playing by a rule on a game board, and they're the only ones on the board. It's silly to me. It's negligence to me. I think that hospitals need to get much more aggressive in how they are dealing with payers, and get more serious about investing on their revenue cycle management team and allowing them to take the lead in getting this money back for them. So you as a hospital executive team, or you've got a shareholder, stakeholder, many of them are failing to use their army of patients. Okay, you ask your patients to help you. You make templates. You give phone numbers. You ask them for help to call payers. You call benefit packages. You call big employers, and you let them know you're paying for a benefit package, and you are the biggest employer in the state, or one of the largest, or you're one of several large employers in the state, and your benefit packages that you're paying hundreds of thousands of dollars for, even millions of dollars for a year for your employees to have insurance through the company, is denying them at record rates. Can you talk to your connection at your payer that you've chosen to let them know that you guys need to start paying for your employees? Do you know that you're providing your employees with a um a plan that is getting denied at this many, this level? And of course, it's HIPAA. You got to be careful with HIPAA. So you say, you tell your contact at United Healthcare or Cigna to give me a call, and we'll fill them in on the detail. But because you're paying hundreds of thousands of dollars, millions of dollars for your employees to have this specific insurance, and this insurance is not paying us, you should be aware of that. And maybe we're not going to see them anymore. You need to play hardball so that those people, the Coca-Cola Inc. or Microsoft or the library or the police, or the fire department, have a conversation with the payers. In any other industry, you are responsible for your insurance coverage. In any other industry, if you own a house and your roof caves in or gets hit by hail, you're the one who's calling the insurance company. You're dealing with the deductible. You're dealing with all of that. So for some reason, the medical industry does not utilize the patients. You think that, or somehow we've grown a culture where we handle it all for the patients, and we're not supposed to disturb the patients. The patients need to get involved in their own care. They will not have a problem. The majority of them won't, as long as you guide them and you tell them how to do it. So there are many ways that you can do this. Record videos, send them out via emails, create templates with codes and things and numbers for them to call, an area for reference numbers. So once they call their insurance providers, they can get all of that information for you. There are many ways to combat and fight and utilize hundreds, thousands of people to help you. Hospitals simply are not doing any of that. They're not fighting back. There's ways to plan for illnesses and the community's needs. If the community has specific health needs, then you don't just wait for them to come to the hospital. You get proactive with their treatment. You make sure you set up their follow-up, their treatment plans, their regular visits. If you need to engage your volunteer base because maybe you don't have the revenue right now to employ people, then you can engage in volunteer drop-offs to make sure that the patients get to the appointments. If you're going to pay hundreds of thousands of dollars on a marketing campaign, then you can create a treatment plan and a treatment program to make sure these patients of yours are getting regular checkups. They're getting every single checkup that they qualify for that is approved by the insurance company. And you're really making a treatment plan with consistent appointments for those with chronic illnesses. So there are many ways to to increase your revenue. And from all of the hospitals that I've seen, worked with, and been involved with, many of them are not doing that. So when you go in and you say this is an option for you, they're fighting you. They love to fight you. You have to learn to love the fight too. And that's the thing. I think a lot of hospitals, especially rural hospitals, you got to learn to love the fight. You got to learn to love it, because if you do not fight, they will bulldoze you and run over you. And the next time you see your hospital in the news, it's going to totally disregard everything that got you to where you are, and it's going to totally disregard how you got to a special interest group. It's just going to talk about the special interest group, and they came from California or New York, and they're just evil. But excuse me, there are many things that you could have done in the meantime, um, to um, to boost your revenue. And primarily, a hospital is a business. The healthcare industry is an industry, but it is a business. So if you're not adapting, if you're not looking at new business strategies, if you're not putting treatment plans together, if you're not trying to put as many appointments in together, if you're not investing in appointment making software so that you don't have to call and be put on hold and then forget to call back, or leave a message and then you don't, and so you never make your appointment. If you want those beds booked, if you want those appointments booked, are you investing in the software that allows people to constantly to be able to get on the books freely without any inhibitors? Are you making it easy for them to pick up their medicines? There are plenty of things that you can do as a business, just as a business model, not even a healthcare model, to make sure your revenue is increasing. And hospitals really struggle with that. And they think it's not important. But in any business, if you do not adapt, you die. So there are a lot of ways. So if you are a hospital or a rural health system, or even an urban hospital or health system that is in need of help and a revamp, feel free to contact me. And if you are a revenue cycle manager or a revenue cycle professional, especially you guys, please get in the comments, because I am almost positive that there's going to be a lot of professionals, MBA professionals, which I love, but MBA professionals who will tell you that everything under the sun is the reason for these closures, except what I'm talking about. But as revenue cycle professionals, builders, coders, payment posters, managers, all of those people, you know that what I'm saying is correct. And you can give a little more insight and maybe give some examples of things that you have seen that kind of correspond with what this report is talking about and what I'm talking about. And then hopefully between the two of us, me doing these videos and breaking down these videos and doing reactions to them, and you guys in the comments, revenue cycle management professionals in the comments, we can trying it through to people to listen to the revenue cycle team, to focus on that first, to invest in that first before you go to the next step, because your solution and your problem is in your AR, it's in your policies, your procedures, and your systems, in your revenue cycle. And if you do not pay attention to that, just like this hospital found out when the special interest group came in and ran it the same way, they ran it the same way, including the way you were previously doing your revenue cycle, which is why nothing got better. That's a problem that cannot be ignored anymore. And we're at a crisis level with all of these hospitals going under. Let's try something different, people. Let's go this route and see where that takes us for the next 5-10 years, instead of jumping ahead 75% in the story and then starting at the back and then going, oh my God, I don't know how we got here. Okay, so that's all for this video. If you'd like to connect with me, you can connect with me on my LinkedIn. My LinkedIn description is down below. If you'd like to get an assessment, you would like us to come in, on my team to come in and see what we can do for your company, we can do that too. Just give us a call. So this is just a really kind of casual video, but I just wanted to get it out there because it was really bothering me, and I hope you enjoyed it. And leave a comment down below if you want me to watch any other video, or you have any other report you want me to analyze. I'd be happy to. Have a great day. Bye-bye.